This podcast is for entertainment purposes only. The opinions expressed in this episode are not to be construed as medical advice.
Welcome to Demystify Beauty, a weekly podcast about transparency in the beauty space. I'm McKenzie Westmore.
And I'm Dr. Paul Nassif.
Hi, Dr. Nassif.
Well, I got to tell you, it's great this week because I have a good friend of mine, Dr. James Chao, who's an incredible plastic surgeon. You know, but what's different about him, it's all, besides the aesthetic parts of what we do, McKenzie, he does all different types of the reconstructive aspect. Now, I know we're going to talk about beauty stuff, and I do want to talk to him about, we heard about Terry DeBro's thoughts about BBLs. I want to really talk to him about that. But I do want to get a brief, when we get him on, I want to get a brief version when we talk about reconstruction of, how many things he, dips his hands into surgically, shall we say.
No pun
but
intended.
Not spend a lot of time in it. Exactly. So let's get Dr. Chao. Welcome, my good friend.
Welcome, Dr. Chao.
Hey, Paul. Hi, McKenzie. How are you guys doing? Thank you for having me on. I appreciate the opportunity to join you.
Thank you for joining us.
Yeah, and everyone, he's in San Diego. But he's in San Diego, but he also comes up and sees patients at my office.
Yep.
Usually on Tuesdays. Yep. And so it's great to have him here with us. But all right, Dr. Chao. Now, very briefly, because I want to get into the meat of this, what led you into the field of plastic surgery? And give us a little tidbit of what are some of the reconstruction surgeries that you are trained in, that you like to do, and you participate in now?
Yeah, absolutely, Paul. I got into plastic surgery because it's really the only field where you actually get to operate from head to toe in all different systems, both the muscular system, the skeletal, as well as functional. And you are taught to think out of the box, much like you, Paul, just your creative thinking. So I think that's what drew me to it. And what I've done a lot recently, besides the aesthetic stuff, is really develop a hand microsurgery practice. I was the hand surgeon for the San Diego Chargers while they were down here for 12 years. Now they're the Los Angeles Chargers, and I still do some work with them, and I still take care of the baseball team, the Padres down here, and a lot of professional athletes in my hand practice, as you know, Paul. And I also do a lot of microsurgery reconstruction, and one of the things I'm known for is to take a leg bone, the fibula straight, and bend it and curve it to reconstruct someone's jaw. With that, when they have cancer or they have an accident or something like that. So those are quite creative things that we get to do in plastic surgery. So it's not just, it's form and function. That's what really excites me.
What got you interested in this in the very beginning, like before you even started? What inspired you?
The inspiration was really a combination of backgrounds where, you could do, clinical reconstruction. You can take care of patients and you get an immediate gratification, where it's not like where you do something and it takes years for that result to come. When you leave the table, as Dr. Nassif will tell you, it's got to look right. His noses look perfect when they leave the table, right? And you don't leave until you do that. So you get that immediate gratification. And for me, the hands, it's got to function, it's got to be moving, right? And doing the right things. And if you don't leave till you do so. So it's not like, well, we'll do something and when we'll see if it gets better. You do that. And then plus, it's creativity. How do you, take your training and knowledge and come up with new things, and you're encouraged to do new things.
So that makes a heck of a lot of sense. Matter of fact, when it comes in, my favorite thing, is golf. And so he takes care of a lot of professional golfers too. And he's actually helped me with my hand, but at the same point, besides the reconstruction, but you are absolutely fantastic in the aesthetics arena.
Oh, thank you.
What is your favorite cosmetic surgery to do?
I end up doing a lot of secondary breast augmentation. So when patients have their implants exposed or capsular contractures to fix that. So I do really a lot of breast issues. much like, what you do, Paul, three-dimensional, the nose is a three-dimensional object. The breast is a three-dimensional object. You have to look at it. It's not a round ball. There could be a teardrop. There could be a slope. So those what we call OG curves that give us great definition and beauty, right? Much like you have in your nose, Paul, great jobs that you do, is that curve and that function and applying, principles to that to get to that point.
Very true.
Then that, leads to the next question for 1 second. This is something, so we have a lot of patients, and I think, McKenzie, you know about this, but, the breast illness disease,
Correct.
the breast implant illness disease. And I want to know your thoughts about that. And then when patients come into you and they want their implants out, what are some of the ways that you can make them look natural especially after that skin has been stretched by the implant?
Yeah, because isn't it, I mean, correct me if I'm wrong, Dr. Chao, but isn't it when you have to go through a reconstruction like that, there's a lot of stitching that goes in with that to reconstruct, obviously, and a lot of scars left afterwards.
Yeah, so there is definitely a lot of stitching, a lot of the internal scars, not just external scars, but the internal scars are what you have to manage. So obviously, the patient who has a massive, leak in his breast implant that has the older implant styles, you really have to be kind of aggressive in that, and it can really cause disfigurement to the breast. And that's where a lot of my secondary or reconstructive experience comes in, where we can then combine procedures where we are taking and treating a little bit like a reconstructive, but then having aesthetic goals as well. So we can then do some back grafting to help minimize scars, as well as we can build internal bras to hold that breast tissue in shape and then reshape the skin over that. So using the patient's natural tissues to do that. And so this, as you explained, McKenzie, this inflation or stretching of the skin with the implant, and how do you control for that? Because, that's going to come up in our future as well, because, one of the hottest topics that we're talking about these days is, BBLs, the Brazilian butt lifts, the fat transfers to the booty.
Yep.
But, I'm old enough, don't know about you, McKenzie, but I'm old enough to see that the ideal model was the Twiggy, right? The 1960s Twiggy, straight up and down situation, and not necessarily the, Kim Kardashian look. And
not Kardashian, right.
And so what will happen is that at some point, just like men's lapels, they get wider, they get narrower, ties, they get skinnier and get fat. There's going to be a contraction. And what do you do? What do these women who had their BBLs done in their 20s and 30s, they want some of that taken out? That's basically a deflation of a three-dimensional object, right? And how are we going to now do that and do that successfully? And that really is going to be understanding the soft tissue, understanding how to rearrange that soft tissue that is left, and then repositioning the skin over the top of it. So not too different than what we do for these women who have breast implant illness and the treatments that we have to offer today.
So I got two questions. So what are your thoughts on BBLs?
I think, the BBLs are an operation that is, very driven by media and looks. It has to be done safely. And right now we've had some problems recently with safeties and things like that. There has been a task force, and one of the major sites of this task force in cases and all that was actually here in San Diego. One of the authors is a good friend of mine that did some of that stuff. And so what we've come up with is a set of standards now, or safety issues, where we actually use ultrasound guided in real time to understand where that probe is going and where that fat has been deposited. Because in the past, some of these deaths have been attributed to fat embolism, where they've been placed in the muscle or they've been placed into a vein. And some of those veins in the gluteus area are as thick as large as my finger. So it's not a joke when you get into one of those and then you put fat into it and you get a fat emboli into the head, and all of a sudden you stroke the patient out and things like that. And at the end of the day, and I'm sure Paul agrees with me, we're doctors, do no harm first. And what that means is, going to a board certified plastic surgeon, and don't go to, in my case, Tijuana, which is 30 miles away from San Diego, and because the weakest link is the member of your team. you may have somebody that trained in the U.S. that's down in Tijuana, but the person who washes the cannulas may not have been, and all of a sudden there's contaminated, or there's other issues.
Oh my God.
Yeah.
Oh God.
You see, that's a great point. And we talk about that a lot on Botched, which is airing now. And, because I know some great doctors. I mean, first of all, I have a lot of friends that are in different parts of Mexico, all through Mexico and South America. First of all, there's some incredible doctors, incredible technique. But just south of the border sometimes, as he mentioned, because we see these patients all the time, just like Dr. James does, again, it's like that. One member of the team, the doctor might be great, but something is contaminated or a post-op problem is not diagnosed. And that's where we get some of these devastating results. I mean, and when it comes to the BBLs, in the beginning, when it first got started, I remember I used to have a number of doctors in the surgery center, and I was the medical director. And I remember one time, I'm with you face, but this was, I had a doctor, a young doctor who was aggressively injecting fat in the buttock area. And then a problem occurred with the respiratory system. And they didn't really, the doctor didn't really recognize it and act quick enough. And then I was, I think, called maybe 5 or 6 minutes after this patient wasn't ventilating properly. And I said, well, what procedure do you? And they said, BBL. And I said, she's got a pulmonary embolism, means it went to her lung. That emboli goes to the heart, then to the lung. And, eventually, she got transported to the hospital, but it ended up being fatal. Especially right when she got to the hospital, maybe 20 minutes later. And it was like, oh my God.
Okay.
So I've been there witnessing, after the fact, of course. And now the doctors, though, that we have, that Dr. James does and some of the other doctors you work with, very careful with it. And again, if you do something very carefully with the right way, and you are an astute plastic surgeon, if there is a complication, you're going to realize it right away. But two, you're going to prevent some of these complications by your technique. And now, is that the standard of care for this procedure now? Is using an ultrasound? I know in some states, James, you have to.
Yes. In the state of Florida, you have to. That's mandated by that's where the majority of the deaths have occurred.
Deaths.
And in California, that has not been there, has not yet. But again, at Oasis and at Prime Plastic Surgery, where Paul and I are partners together in collective practice, we are not about the lowest bar. We're about the highest bar. And that's really what the difference is, right, Paul? The board certification for us is standard, but we're not here just to do board certification. We're really here to lead the pack. And Paul, with his history of leadership and why he's who he is that whole idea. And all of our partners are the same way. We want to lead the pack. We don't want to follow the pack. So I think right now the right thing to do is real-time ultrasound, know exactly where your probe is at what level, and be trained on the ultrasound, not just take the weekend course, but actually get certified doing that. So all of our doctors are certified to have certificates, the same type of certificate that a radiologist or a radiology ultrasound tech would have, in identification of blood vessels, soft tissue, nerves, muscle, and cartilage. And that's what you have to do and understand those differences.
Wow. I mean, I have to say, as a patient, that's what I love about what Dr. Nassif and I are doing with Demystify Beauty, is talking to professionals such as yourself, because that's where I think many people make the mistake, is they think they can go anywhere. But you've got to do your research. People, men and women, they need to do their research. They need to take the time to do the background, to really see exactly what you're talking about. Everybody on your team, both of you, everybody is certified. There is not one missing link in the puzzle or in the team. And that's so important.
Yeah. You couldn't be.
Well, that's
more
also
accurate.
where the anesthesiologist, comes into play too.
Yeah.
So the anesthesiologist really has to also be astute when you're doing these type of things, Are you still seeing a high desire to have BBLs? And if you are they asking for smaller buttocks, smaller booties?
I would say that there's really, the curve is no longer the standard distribution. It's starting to spread a little bit where I start to see, okay, I just want, the dimple fixed. I just have this little dimple on the side.
Oh, so subtle.
The subtle, I just have this little dimple that looks like a Pepsi can that has just a little bink in it. I just want that, kind of rounded out, that dent popped out type of deal. To the ones that, I want to be bigger than Kim. The ones in the middle, in my opinion, have kind of naturalized out. And so we're starting to see, really what I call extremes, where you get caricatures where you go, I want this to be my defining feature, or I just want this thing kind of corrected a little bit.
Interesting. Yeah, see, for me, my growing up was Pamela Anderson and Kate Moss. So it was all very top heavy.
Yeah.
There was no bottom.
Right.
So it's very interesting to watch the trends and how they recycle, how they come back around, how they don't.
Yeah.
I'm very curious to see how this trend will turn out in 10, 20, 30 years from now. Will we continue on to caricatures, or will it backtrack?
I think it'll backtrack. It's just, again, like I said before, like men's ties. You get skinny ties.
Yeah.
At a certain point, you keep them long enough. I can recycle my skinny ties from the 80s, back down here.
Right. Right. Exactly.
But the problem is how do you then deal with the skin envelope and the sagging that's going to occur? If they've had one and they say, Doc, I'm good now. I'm in a different phase of my life. I had it in my 20s. Now I'm in my 40s. I've had 2 children. I'd like to have some of that taken away. And plus the gravity of it has
a lot of skin
sagged down a little bit. And so we're going to see more butt lifts, more than just the BBL, but the true excisional butt lifts, where we're going to shape the skin, and then also the ligaments and things that are underneath that to move that forward or north. And again, it'll be much like what, again, Dr. Nassif does with the deep plane facelifts, that they're not is just the skin, but actually the tissue underneath it, and moving all that fat and that composite tissue up to give you that true natural looking butt lift versus just tightening up the skin, type of deal. So I believe that that's going to happen in the future.
I got to ask, because you are plastic surgeon, you are reconstructive surgeon. What is the most dramatic situation you've seen, the most dramatic surgery case that you have ever put your hands on?
Well, there's a couple of spectacular ones that I
like spectacular.
I trained in New York City at NYU Bellevue, and the helicopter police captain had his hand cut off by a rotor, and it landed 40 stories on Madison Avenue. He was brought in, and the hand was brought in separately. They shot down Madison Avenue, and they found the hand, and they brought it in, and we reattached his hand, type of deal. So that was one spectacular situation. And then I've been involved with a number of the overseas face transplants that were done in China and things like that. So those are some very interesting, out of the box thinking in cases there. So again, I've been very, very blessed to have these opportunities, as I call them, to participate in some of the stuff that we read about in newspapers and have patients that make the news and type of deals. I'm blessed.
Well, to add to that, we have, which will probably end up being the final segment of this season 8 of Botched.
Mm-hmm.
We probably have the patient of the whole series. And Dr. Chao helped me with her. A young lady from Mexico City came in with this thing called a neurofibroma, which is a gigantic mass on her face. And we removed it, and we used some of the technology that Dr. Chao knows about, and with me, and at my friends, the CEO of Sharp Hospitals in the San Diego County area. We did this case, and so we, worked together. And that, is going to be an incredible, I can't talk about the outcome yet. Of course, it'll be on eventually. But that was an incredible case, of doing that together. So, it's nice doing these very complex cases, and that's what we do. We do very complex cases and easy ones, obviously, too. And, it's nice, too, on certain cases, Dr. Chao and I are able to operate simultaneously.
Yeah.
So if he's doing something below the face and I'm doing something on the face, depending on what that is, we can actually go ahead and do it simultaneously.
Yeah, we do a lot of double teams. It cuts the surgery time down, and we all know that length of surgery is tied to outcome.
Interesting. So less anesthesia, better outcome.
Yeah.
Well, you understand that, but that's a good point. I want to mention this to Dr. Chao, let him add. So a lot of patients will come in and say, well, how much is too much in surgical time? And I do know when I'm operating on the face, since there's not a lot of what we call fluid shifts like there is in the body, and we can actually do, lighter medication because we give a lot of numbing medicine in the face. I do know from my whole career, I have done, I've performed a lot longer cases than they do on the body. So tell us your thoughts about that, especially with body surgery and the do's and the don'ts in regards to anesthesia and timing.
Yeah, sure, Paul. So I 100% agree with you. The body has a lot more fluid shifts, and especially if you're doing liposuction or the BBL stuff, where you as a surgeon are creating those body shifts by adding so much additional fluid, withdrawing that fluid, and then putting fat back in. So that's one of the hemodynamic parameters that we measure. So therefore, it's not only just the surgery, but where you do the surgery that's important. So most surgeries that don't have large fluid shifts can be done safely in an accredited surgery center, but the larger cases that have larger shifts may require overnight stay. Certainly, when we do our surgeries, I do all my surgeries, I only work with board-certified anesthesiologists. In fact, my anesthesiologist has been with me for 18 years, so I know exactly what he does, and we're a team. So he knows, he's seen me do this thousands of times. He goes, oh, time for the paralysis. He doesn't give the paralysis at the beginning. He gives it exactly when it's necessary. He knows exactly how long you take, so he gives the exact right dosage, so they don't wake up nauseous, they don't wake up vomiting. There's very little fluid shifts. He keeps on talking. So it's a team approach, like we talked about in the beginning. That the surgeon is only as good as the teammates that he surrounds himself with. And then obviously these larger cases, they really need to have overnight stay or monitoring, or just be done in a hospital setting. It may cost the patient more, but what's the value of a life? There is no money that you can put on it. And again, as I said before, first, do no harm with doctors first.
Now, I got to ask, we touched on BBLs, but are there other controversial surgeries that people are not talking about that you do think are successful?
Oh, the number one thing, and, I got some good colleagues to suggest and all that is, female sexual issues and female sexual stuff. So vaginoplasties, labioplasties. Again, there's so little research that is done in those areas in terms of menopause compared to, erectile dysfunction, right? We've had, the little blue pill. Wow. It's gone through its life cycle. It's no longer patented, yet there's still no female Viagra type of situation. So I think that's going to be the next wave of going on. So, and again, September is Female Sexual Awareness Month. So that's coming up. So I think those would be great things to talk about and get those people on. I do a number of vaginoplasties and labioplasties in my practice with what's going on. And I can tell you that patient population is quite silent. And it's shows like yours and your championship, McKenzie, as a female to put that information out there is going to be very worthwhile because I'll have people come in the waiting room and they don't even know each other, but they're happy to share their breast stories with each other. But the stuff that's down there, no one wants to share. And if you look at our website, it's all Googling after 10:30 at night is when they come on. And so there's that taboo
Oh my
type
goodness.
of a situation. In fact,
That's so sad.
yeah, in fact, there's an article that was recently published in, I believe, USA Today about that, the taboo of that issue there, and it could actually be $1 trillion industry when you look at what that looks like. So I think that's going to be the next area that we look at on that.
When you say, so just so that, again, for our listeners, when you talk about vaginoplasty, can you give some examples of what you do? What are the complaints?
Yes.
How you fix it?
Yeah.
Yeah.
So very typical complaint is, Doc, I have pain now after I had given birth to my babies with sex because I had a tear or I had an episiotomy. And it wasn't put back correctly. The doctor just stitched it and hogged it together. You didn't put the layers back. There's a scar tissue. Well, as a plastic surgeon, that's what we do. We manage scars, right? Everybody has a scar they wish to keep called a belly button. So I'm not a scarless surgeon. I'm a surgeon that basically controls scars, right? So you want to keep your belly button, that's a scar. I'm controlling it. So there's a scar down there because of the episiotomy. And so we can then make a Z-plasty and create laxity so the pain goes away. Or, hey, Doc, I just, after delivering 2 10-pound babies, okay, it's loose down there. Well, we can tighten that up. Or the labia got really large. It's interfering with my activities of working out. It gets caught, it gets pinched, it hurts. So these are things that we can do not only for just looking better, but really functioning better with that. And they're all suffering in silence a lot of times. And a lot of them come to me and say, well, Doc, I haven't talked to my husband about this, but this is what's really bothering me. I'm concerned about this because if I say something, it may hurt his ego, whatever that is. And so those are things that shows like yourself here, that can talk about this and they can get information. There's nothing wrong with what that is. It's not a taboo subject.
Well, it's not, and it is important to talk about. And I remember I posted something on my Instagram about this exact topic because I had surgery to remove tumors, and it left me like the Grand Canyon, if we shall. And I was not happy. Sorry, just being honest. That's, but that's the honest truth. And I don't see the taboo in it. And when I posted my story on my Instagram, I had people going, oh my God, how could you talk about, it's like, why not?
Exactly.
And I know I'm talking to 2 men about this, but you're 2 men that understand this.
Yeah.
So I just feel I'm so happy to hear you speak about this because I feel this is a topic that a lot of women don't speak on. Yes, we're so easy to talk about our boobs, but we won't talk about what's going on below the waist.
Yeah.
And I think that's sad.
Well, it's at the same point, there are, in the first scenario, there's the radio frequency that we have before surgery that you can try.
Yeah.
Like we have here, Thermi Smooth. I don't know where you have it, James, down there, but it's a wand. And again, it treats a few things. One, it actually, with treating with the radio frequency, it actually adds a little bit because, as women get older, they get more dry down there. So you get more moisture. 2, it actually increases the sensitivity. 3, it helps even with the incontinence. 4, it tightens. 5, it actually makes even the labia. It does
from
all
inside
those,
and out. Yeah.
Inside and out, with that. So we have patients that come in and our nurse practitioner will take care of that. However, and that's always a good way to start.
Yeah.
And then that, of course, you need to go the extra, depth into this. And that's when you go to someone like Dr. Chao. And, it's great, Dr. Chao, and I want you to talk to our office staff about this.
It is.
Because I didn't know that was one of your big specialties was, working in the, working in the vaginal area and all that.
Yeah. So
look at what we did here.
Yeah, look at that.
Bringing worlds together.
Thank you.
I love
Thank
it.
you,
McKenzie. That's actually, nice to hear that now we're talking about something that a lot of our, lovely listeners would like to know. So the thing is, so let me ask you this, the recovery after a labioplasty.
Oh, yeah.
What is the recovery like?
Yeah, what is that?
It's actually relatively easy. some of these labiaplasties I can actually do in the office under local, because there's certain nerves. If you know the anatomy, you can get these what's called the pudendal block and actually take care of that, and it's painless type of deal. Most women are healed in about 2 to 3 weeks. I tell them cautiously, no sex for 4 weeks or so, and then they're basically doing sitz baths and things like that. They're only on narcotics for maybe 24 to 48 hours. The rest of the time it's Tylenol or ibuprofen. So very, very well tolerated operations type of deal. What we do ask is we do look for the timing of the operation. So we ask that we don't do the procedure during their periods, because it's hard to
menstrual cycle.
Yeah, it's hard to monitor what's bleeding and what's not bleeding in terms of the surgery itself. So these are all little nuances. Again, that's why you want to go to people that are trained, understand the anatomy, can take care of the complications associated with that, and have a track record. So ask those questions. Even though it is considered a sensitive area where people are not talking about it, this opens the light, shed light on it, so they can feel comfortable talking about it and not be embarrassed.
That brings me to a quick question. Then if you do have a patient that has, say, an abnormal menstrual cycle, and maybe they do bleed often, what do you do in a case like that?
We can understand what that cycle is. We can also cycle them on birth control pills and various other things. So again, it's a team approach to all of this. Again, what I love about what I do is there's many solutions to your problem. So Paul mentioned some non-surgical options. We have some additional non-surgical options as well in terms of, I know Paul has a NEO, which is, the electromagnetic and radio frequency device as well, CME, that helps strengthen the pelvic floor. All of these things that will help urinary incontinence, improve, sexual sensation, desires, and all that. And then also there's, injections, O shots, G shots, and things like that we can do to enhance, those functions there. And obviously bioidentical.
I'm so sorry, what's an O shot?
Those are different parts in the vaginal vault or in the introitus area, usually anterior, that have a lot of nerve endings. And so what we do is as you age, some of those areas become more atrophied. So we can actually use filler or fat and transfer in that area to plump those areas so that there is more quote unquote friction or pressure to give more sensation to that. So again, a lot of women come in as they get older. I feel very dry. So those can be helped by creams and bioidentical hormones. And I just don't feel the same sensation as I did when I was, prepartum, before I had babies and things like that. Those are things that we can help them with to make their lives more enjoyable and fulfilled.
That's amazing. I love having people on like you, Dr. Chao, because passion. I'm all about passion.
Sometimes a lot of these OBGYNs, if they do it like anti-aging medicine, they know exactly how to treat, the female hormonal level when it comes to the bioidentical hormones he's mentioned. Also, sometimes a little bit of testosterone, the right amount. And
we know that one well.
So exactly, we've talked about that.
I do the pellets. We have that in our office here. It's once every 6 months. They do the pellets type of deal. It's kind of like, it's a little pellet that they put into kind of into your flank or near your buttock area. You don't feel it. It's like one of those, things that women do, ortho implants underneath their arms or something like that. And I don't have to worry.
Then you would probably know the answer to this because of all these surgeries that I had to go through. It did throw me into almost like an early menopause, and I'm far too young for a menopause, but because of that, I didn't want to go through the symptoms. So I've chosen to do progesterone, testosterone, and an estradiol patch. Somebody did mention to me pellets for all three.
Yes.
Is that possible?
Yes, it is.
Really?
Absolutely. Yeah, absolutely.
It's a lot of work I got to do right now.
Yeah. So it's all, for me, I'm a terrible patient. So I just want to be. I'm a terrible patient.
Make it as easy as possible.
Yeah, I do a lot right now.
Now, so since besides you coming up here to see patients, here in our office up in the Beverly Hills area, you're in La Jolla mostly?
Yes, I'm in La Jolla, and then Encinitas, which is the north end, or Rancho Santa Fe. I've got offices
I
there.
love Encinitas.
Yeah, so those are the two places that I predominantly reside at. But those are my offices, and obviously I do a lot of surgery in the hospital systems, and chief over at the Sharp Systems, so which is where we did our surgery together for the botched case recently.
Well, I'll tell you something. I mean, this was a great segment because we haven't really talked about, really got into BBLs. And if you are going to do it, here's the best way to do it.
Yep.
And then some of the aspects of it and the dangers, but also some of the positive outcomes and where the field is going. And then especially about the vaginal surgery.
Yeah.
I mean, aesthetics and functional combined,
I want to take the taboo off of that one.
Yeah.
I mean, it's eventually going to get there. Remember how no one wanted to say they have Botox and everyone says
yes,
they have Botox?
Yeah.
And
you're
now,
almost weird if you don't.
Now, I've had my boobs done numerous times. And then eventually, depending on who needs what.
We're working our way down.
The vaginal area. Exactly. I mean, and then again, there'll probably be more mainstream penile surgery. Who knows for erectile dysfunction ED that, I know urologists mostly do that though, don't they?
Yeah. But I get called in to do some micro cases with that because it revolves the nerve. Because sometimes they've been injured in radical prostatectomies. Can we then bypass those nerves and get function back and things like that? So these are all evolving areas. We're getting better and better at what we can do and what we can offer surgically.
Amazing. I could talk to you all day, Dr. Chao. It's fascinating. And I love hanging out with Dr. Nassif.
Yeah, absolutely.
But Dr. Chao, where can everybody find you? Do you have social media, website?
Yeah, I'm not a big social media guy, believe it or not. My brother is a huge social media guy. He's the pro football doc. He's got like 600,000 followers, not quite as many as Paul, but they can certainly call my office or go to the Prime Plastic Surgery website or the Oasis MD website. The Oasis MD is my reconstructive practice, and the aesthetic practice is primeplasticsurgery.com. And you'll see me there. Yeah. Or call Dr. Nassif because I'm there on Tuesdays.
That's right. Come over here.
That's good to know.
Paul's the guy that everybody knows. Paul knows everybody.
Call Nassif MD.
Yeah, call Nassif MD.
Yeah.
I love it.
Yeah, but we have to get a good old, and it's funny having James up here because, what's nice is one thing too, when you're a doctor, in what we do, one, you want to make sure that you have good aesthetic sense, many surgeries in your armamentarium if you get no uncomfortable situation or something different, and also well-read and well-versed. So he has all of that, So we're very lucky to have you. And Dr. James, thank you for having you on our show.
Thank you so much.
And, of course, I can't wait to see you.
Yes, absolutely. Thank you, Paul. Thank you, McKenzie.
Thank you so much. And everybody listening or watching, please be sure to check us out on YouTube, Demystify Beauty, wherever you want to get your podcasts. Subscribe, like, and send us those questions. We're loving the questions you're sending. So thank you, everybody. Thank you, Dr. Chao. Thank you for listening to Demystify Beauty, produced by Gotham Production Studios. If you have any questions for future episodes, please don't hesitate to reach out to us on Instagram at Demystify Beauty or email us at demystifybeauty@gmail.com. And don't forget to subscribe, rate, and review the show. See you next time.